Well, hello everyone, and welcome to our free webinar for October that's focusing around Safe and Drug-Free Schools and Campuses Act and providing you with some updates and a review with Dr. Eric Davidson. My name is Cindy Clowner. I'm with the Higher Education Center, and we're so glad that you can be with us today. Before we get started, we just have some housekeeping things we'd like to go over with you. We welcome any questions that you might have throughout the duration of the program. You can ask them in the question chat box on the right-hand side of your control panel, and Eric will answer those as we have time at the end of our presentation today. We encourage you all to learn more about how to become a member of the Higher Education Center. Membership includes access to our Screen U alcohol, prescription drug, and marijuana program. A Screen U is a web-based screening, brief intervention, referral to treatment program. It also includes access to our Recovery Ally training materials, our learning collaboratives, both past and current, and discounts to our annual national meeting. You can learn more about our membership benefits by visiting our website at hecaod.osu.edu. And with that, it is my pleasure to introduce to you Eric Davidson, who currently serves as the Interim Director for the Eastern Illinois University Health and Counseling Services, overseeing the university's health service, counseling center, student insurance, and health promotion programs. During the majority of his 22 years at EIU, he has led campus health promotion and prevention efforts and student affairs assessment practices. Since 2009, he has also directed the Illinois Higher Education Center for Alcohol, Other Drug, and Violence Prevention, overseeing training and professional development for higher education practitioners, implementing campus substance misuse programming. Eric assists campuses with understanding Drug-Free Schools and Campuses Act requirements, effective prevention programming, and assessment and evaluation. Eric possesses a PhD in health education from Southern Illinois University and a master's degree in clinical psychology from Eastern Illinois. He is also both a certified master's community health education specialist and a certified senior prevention specialist. Eric, thank you so much for being with us today.
Thank you, Cindy. Today we are talking about complying with the Drug-Free Schools and Campuses Act, and when I usually give a webinar or a training on this topic, I always like to refer everyone to the manual that you're seeing on the screen, and this is the manual that I refer to as the Drug-Free Schools and Campuses Bible. So if you're not familiar with this particular document, you will see a URL link at the bottom of the slide where you could go and you could download this document. It is really our guidebook as to what we should do and how we should go about complying with the Drug-Free Schools and Campuses Act. One caveat that I like to give is that this book is actually over 12 years old. It was last published in 2006. So if you think about that timeline, how old it is, plus the time that would have been required for the U.S. Department of Ed to review and vet this document, some of the guidance is really probably 12, 13, 14 years old. And that tends to be a little bit frustrating, especially when we talk about electronic distribution of the Drug and Alcohol Prevention Program notice, which we will get to in a few slides. So a lot of my content comes from this book. A lot of my content may also come from what I refer to as the narrative of storytelling. So through conferences, through workshops, through panel discussions, through conversations with Department of Ed folks, with conversations with Beth Tirico, who is a primary author of this document. Some of the things that aren't in the document have really been relayed through storytelling and conversations. What I'd like to begin with is some of the main elements of the Drug-Free Schools and Campuses Act. And if we look at the requirements, Part 86 of the Drug-Free Schools and Campuses requires that as a condition of receiving any funds or any other form of financial assistance under any federal program, an institution of higher education must certify that it has adopted and implemented a program to prevent the unlawful possession, use, or distribution of illicit drugs and alcohol by students and employees. So the simple paragraph really says, this is what we have to do. And from the simple paragraph, we end up getting a lot of questions. So a lot of people will ask me, well, what does it mean to certify? What does a program mean? What is a program illustrated as? What does it mean in terms of unlawful possession, use, or distribution of illegal drugs? And those are things that we are definitely going to cover today. Certification can mean several different things, but for most of us, we are dispensing and disseminating financial aid funds to our students. So through Title IV of our financial aid agreements with the Department of Education, if you're giving financial aid to students, your institution has agreed and certified that it will be abiding by the Drug-Free Schools and Campuses Act. For other forms of federal funding, say grants that maybe some of your teaching faculty or other colleagues on campus might be getting through the federal government, a lot of times through those grant writing processes, the institution must also certify compliance with a number of federal mandates, and this is typically one of those. One of the questions that we often get is, well, what does this certification mean? What's the certificate look like? And I just happened to get lucky one day. I was cleaning out our office and I was going through some files and I came across a file that said Drug-Free Schools and Campuses Regulation. And in that file folder was the certificate that Eastern Illinois University was required to submit to the Department of Ed in August of 1990. At this point in time, we do not submit anything to the Department of Education on any regular basis for anything related to Drug-Free Schools and Campuses Act. The only time we ever do that is if they come to us and they request us to do that. But in August of 1990, we were all required, our institutions were all required to basically complete and sign a form similar to the template that is on the slide currently. So after having found that, I use that on our campus, and I really recommend universities and colleges to make a template of their own, have their leadership sign off on it, and include that with their biennial review report as a means of saying, yes, we are aware of the Drug-Free Schools and Campuses Act, and these are the requirements that we are abiding by. I will make a template of this document as a Word document available to Cindy, and she can post that or distribute that to the listeners today for those of you that may be interested in utilizing this template. In the old days, when the Department of Education had much more money and were able to have national conferences, they would have a national higher education, alcohol, and other drug meeting. And that last meeting was held in October 2010, so almost 8 years ago. But at that meeting, Norris Dickard, who was the official from the Department of Ed who was responsible for overseeing the Drug-Free Schools and Campuses Act, also gave some verbal guidance. And again, you won't find this written down anywhere, but I think it's important guidance to heed. And what he said was that if your institution of higher ed ended up having transition and you ended up having a new senior leading administrator, and for many of us that would probably be a president, shortly upon the arrival of that new senior leader, they really needed to sign that certificate. And he said, if you've got an ongoing president or an ongoing leader, they really need to certify that minimally every 5 years. So again, as a matter of practice, what I typically advise institutions is to have that certificate signed by someone up high as you can go and get at your institution. And again, put that in your biennial review as one of the leading pages. Now, when we look at the minimum requirements of Edgar 86, the drug-free schools, there are really three main elements. One is that we have to have a drug and alcohol prevention program. We also have to have a drug and alcohol prevention program notice that we are distributing to all students, staff, and faculty. And then every 2 years, we have to prepare a biennial review report that really looks at two aspects: the effectiveness of our comprehensive alcohol and other drug program, and the consistency of policy enforcement. And one of the things that, if you are a nerd like me and you go look at program review findings, one of the things that you're finding for schools that are not in that are found in violation of this, there's kind of a hierarchy in action and scope and sequence to these three things. You have to have a drug and alcohol prevention program in order to be able to develop and create a drug and alcohol prevention program notice. And when you do your biennial review, you need to be looking at both your drug and alcohol prevention program as well as your drug and alcohol prevention program notice. There have been some schools that have not been developing, writing, or creating that notice, but have been doing a biennial review. And when they have been audited, they've basically been told, you can't have a biennial review because you don't have a notice and you don't have a program. So there is, in some aspects, a sequence to this. So you really do have to have a program, you have to have a notice, then you have to have the biennial review. There are some additional requirements. One is what Beth DeRico would refer to as the letter of the law versus the spirit of the law. Following the letter of the law is probably pretty easy. Following the spirit of the law gets to be a little bit more complicated, a little bit more complex. But when we think of the spirit, the regulations really expect that we will be developing our comprehensive alcohol and other drug program based upon current research, evaluation, best practices, that we are using data to drive our decision making and what we're doing on our campus. That we're also focusing on prevention and that we're focusing on primary prevention. It's okay to have intervention, it's okay to have treatment, but again, a focus of our work really should be on prevention activities, primary prevention in particular. And what you will see if you go look at the program review findings is that these programs are being referred to as the Drug and Alcohol Abuse Prevention Program. You will see that consistently. So in the past, I may have referred to our annual notice as the annual notice or the Drug-Free Schools and Campuses Act annual notice. I'm really encouraging people to use the same language that the Department of Ed is using and really refer to as the Drug and Alcohol Abuse Prevention Program or the Drug and Alcohol Prevention Program notice. Now, one of the questions I get all the time is, okay, we have sat down, we have written our biennial review, we have created our drug and alcohol abuse prevention program notice. What do I do with it? At this point in time, you do not send it off to the Department of Ed. There is not a place where you upload it online to go to the Department of Ed. Unless they request it, you do not send it to them. However, I do have some recommendations. I really recommend institutions, once you have a biennial review report and a copy of the notice, that you send those to your president, your senior level administrator for signature and certification, that I encourage you to send it to your financial aid director, that you send it to your clery compliance officer. A lot of times the Department of Ed is going to come to campus and conduct an audit. They will conduct a Title IV audit or a clery compliance audit. So it's really great for those two people to have it. If you have an Office of Research sponsored programs, I encourage you to send that to that office. So that way, as they're applying for grants from the federal government, they have the documentation to be able to say, yes, we know that the campus is doing this. And then the other place is, any place where you would think anybody would go to for an alcohol report. So whether that be your health service, your counseling center, your health promotion office, your campus security office, anywhere where these items may be requested. I often get a lot of questions, do we put online? And that is really an institutional decision. At this point in time, it's not a requirement of the Safe and Drug-Free Schools Act. I see more and more schools doing it, but that is a decision that your institution really needs to make. One other question that I often get is, okay, we've made these things, how long do we have to keep it? Well, the things that you have to keep would be a copy of your drug and alcohol prevention program notice, your program certificate, your biennial review or any results and findings of your biennial review. A lot of people will say, well, do I need to write a report? And my response has typically been, well, if you have a review process, you need to have some kind of document that outlines what it is that you've done, the data that you've collected, your results, your findings. So it seems like you would have to have that written down, but you have to have something, and any other records reasonably related to your compliance with certification or your programming. So I know a lot of schools may be implementing the Core Alcohol and Drug Survey, the National College Health Assessment, and a lot of times they will attach the findings of those surveys as appendices. But in terms of the length of how long you have to keep it, you need to keep it for 3 years after the fiscal year in which the record was created. So I'm going to make an assumption that many of you right now are in the process of doing your biennial review for the 7-18 and 16-17 years. It's fiscal year 19. So anything that you would create now for the last 2 years, you would keep through fiscal year 20, 21, and 22. One of the questions I often also get is what is meant by program. And interestingly, when the regulations were written in the late 80s, the Department of Ed really did not give clear guidance as to what a program is meant. So this is where it gets really frustrated. For those of you that are familiar with Clary, we have a nice 3-ring binder full of hundreds of pages, and they're very precise, they're very specific. They outline really everything that we need to do. When it comes to the Drug-Free Schools and Campuses Act, that guidance is not really offered. The intention was that the government knew that this would be an unfunded mandate, that campus culture would be different from campus to campus. Therefore, there would be some autonomy for campuses to decide what was best for them. Some institutions will sit there and say that the drug and alcohol prevention program notice constitutes a program, and that notice really is the minimal level of programming that we're required to do. But as a health promotion specialist, I don't necessarily believe distribution of a notice is really a program. I really think that programming is much larger, it's more encompassing. And when we look at where we are at as a field, we know that information-only approaches typically are not the most effective means of prevention, and we really need to be looking at best practices in science. And again, it goes back to that spirit of the law versus the letter of the law. When I think of what the spirit of the law is, it's a comprehensive program, and that comprehensive program entails more than just educational and therapeutic interventions. It also includes policy, it includes sanctioning, it includes environmental strategies, and really we are looking at a social ecological framework. And even if we sit and we look at the scope of care that we are to put in our drug and alcohol prevention program notice, there really is a continuum of care ranging from prevention programs, assessment and identification of problems, intervention, treatment, rehabilitation for our students that do have misuse issues, as well as re-entry programs for those that may have taken a leave of absence from an institution to get treatment and now are re-entering. So while not specified at that point in time, I would also add many of the recovery programs that many of us are beginning to implement or have implemented on our campuses. There are also several other frameworks that I encourage folks to consider using. The Department of Ed actually created a Principles of Program Effectiveness several years ago as a result of some of the alcohol related grant programming that they were able to develop. One of the set of standards that I really like is the former network of colleges and universities committed to the elimination of drug and alcohol abuse standards that really looked at things such as policy, enforcement, student assistance and education, community organizing and mobilization and enforcement. If you are a member of the American College Health Association, you may be familiar with the standards of practice for health promotion within higher education, and hopefully many of you are familiar with the NIAAA's College Alcohol Intervention Matrix. So again, these are really great frameworks to use when considering what a program should look like, as well as possibly what you may want to use in terms of evaluating and assessing your comprehensive program. In addition, we also have the Council for the Advancement of Standards in Higher Education. There are standards specific to alcohol and other drug programming, as well as health promotion, counseling, health services, and I believe that there is a new set of standards that are coming out that kind of look at problematic behaviors and addressing it through a collaborative point of view. And then we can also refer to Healthy People, Healthy Campus 2020, 2030. So again, some great frameworks out there to look at in terms of developing a program, determining strengths and weaknesses of a program, and again, looking at how we can assess programming. The U.S. Department of Ed had some grant projects in the late 1990s, early 2000s that I would refer. There are two really great documents. One's called the Experiences in Effective Prevention. The other is Field Experiences in Effective Prevention. And in many ways, both documents kind of highlight a qualitative study of the grant projects and really what seemed to be working among all of the grant participants, and address things such as using evidence-based programming, collaborations, coalitions, student involvement, communications, data-driven programming, strategic planning, those types of things. So again, great documents for those of you who are developing and initiating a substance prevention program on your campus, or looking at how to beef it up and make it much better. Moving into another area, we will talk about annual notification. And one of the things that often comes up is, is our clearing notice adequate for the Drug-Free Schools and Campuses Act? And they are not the same. They are really two different mandates. The notices ask for different information to be contained within both documents. So they're not the same. And one of the other things that I often get a lot of times is, can you look at our notice, Eric, and tell us if it's okay? And there are specific areas of content that need to be in the notice. And what I typically like to tell people is, if you have a notice or a policy that is less than 2 pages, you're probably not doing it correctly, and you're probably not including all of the information that is required. One of the other things that is different between CLARI and the Drug-Free Schools and Campuses Act notice is, with CLARI, a lot of times you look at your roster of everybody who's on your campus before October 1st, and you send it to everybody, and you send it out once. The Drug-Free Schools and Campuses Act looks at it much differently. So it's not just necessarily sending it out once, but really everyone on your campus needs to get that notice at least once within a 12-month period. And when you look at the slide, you will see some text at the bottom that says the distribution plan must make provisions for providing the day-app disclosure annually to students enroll at a date after the initial distribution, and for employees who are hired at different points throughout the year. So you may have a main distribution in the fall, say September, October, but you still have to make means and engage in activity that would get that drug and alcohol prevention program notice and disclosure to the students who enroll in the spring, the students who enroll in the summer, as well as any employees who join the institution after that initial distribution. You just can't wait till next year to catch up and get caught up on everybody who should have gotten it. The notice is required to be distributed annually in writing. And again, if you have new students or new employees, they must get it. The philosophy is that you must engage in active distribution of this notice. You cannot engage in passive methods. So if your institution basically has the drug and alcohol prevention program disclosure notice, and you put it on a table at summer orientation expecting students and parents to pick it up, that does not suffice as a primary distribution method. It really needs to be active, and you must go to great length to do your best to ensure that all of your students, staff, and faculty get this notice. When these regulations were first developed, we probably didn't imagine electronic distribution. So if you go look at that 2006 guidebook, it really doesn't give us much guidance as to whether or not we can use email, can we use the internet, and those methods to distribute this notice. In 2010, at that last National Higher Ed meeting, there was a panel that convened, and some of the things they basically said is, if you want to use email, you need to have it be official policy that official communications will be sent to students, staff, and faculty through the email, and that you need to have some mechanism in play to assure that a majority of your students, staff, and faculty are actually accessing, utilizing, and opening up their campus-based email. Someone said over 90% of your students need to be doing that. So if you're thinking about distributing by email, you need to make sure that that method or that channel is something that folks are actually using and able to get that policy. At that point in time, what we were told was, if you were to use email, you would have to include the content of the entire notice within the body of the email. So you just couldn't link it to a website. You had to put everything in the body of that email. Luckily, we've had some recent changes. In a program review determination from Occidental College, what that program review determination says is that an institution may distribute the annual disclosure by electronic mail if it wishes to do so. The method for such a distribution would require the institution to post program materials on its website and then send an email message to each mandatory recipient that includes a direct link to the document. This is the first time that I have seen this. This is the first time that I've heard it. So one of the things that I encourage institutions is that if you are wishing to send an email to your students, staff, and faculty with a link to your drug and alcohol prevention program notice, keep this nearby, so that way if you end up getting audited and it's questioned, you can sit there and say, well, this was the guidance that was provided to Occidental College, and we're doing that. Having said that, remember that this notice is independent and separate from other notices. So if you end up sending out a plethora of policies and notices and just say, here are our policies for XYZ institution, please read all of them, that does not suffice. That does not meet the standard. You really need to do it separately based upon the advice that is written here. So when we look at the notice, 2 pages may not cut it. What needs to be included in it? And when you go back to that 2006 manual, it says we need to talk about standards of conduct, applicable federal, state, local, and institutional laws and sanctions, a description of short and long-term health risk, a list of your prevention and treatment programs available to students, staff, and faculty, and a clear statement that your institution will impose disciplinary statements. So when we think of standards of conduct, we think of who should be getting this notice. Any student at your institution that gets any type of credit for any course they take, except for continuing ed. When this regulation was developed in the 80s, probably many of our institutions had a clear line. You're either an on-campus student or you are considered a continuing ed student. Nowadays, we have on-campus students, we have online students, we have continuing ed students. You may have dual credit students, where you have students who are in their high school taking classes and getting credit for a similar class at your institution. You really need to sit down and look at the types of students that you have, the types of programs that they're enrolled in, and make sure that everybody who is getting any type of academic credit for any course that they're taking outside of continuing ed is getting this notice. You also need to realize that students who work for your institution may not only have the student policies and regulations that they have to abide by, but there may also be some employee policies that they have to abide by. So if you, for example, if you have a student that gets caught in violation for an illicit drug and gets prosecuted, is that being reported to your Department of Human Resources, and are they reporting that to the federal government as a regulation of the Safe and Drug-Free Workplace Act? You also need to think about what constitutes an on-campus activity, what constitutes an official off-campus activity, and what is the gray area and where your students of conduct may or may not apply. Legal sanctions, they really would like for us to list legal sanctions of local, state, and federal law. Some community colleges may have a little bit more difficulty with the local law, being that their service catchment areas could comprise many different communities and many different counties. You really have to figure out what is best based upon your institution. But most importantly, it should stipulate that any student, staff, or faculty member who violates any of these could be subject to institutional sanctions as well as criminal sanctions outside of the institution. Health risk. This is the minimal level of information that we must distribute to students, staff, and faculty. And really, we need to look at the health risk associated with the use of illicit drugs and the misuse of alcohol that occurs on your campus. And this gets to be pretty interesting. What I see a lot of times and what I think is best practice is that we list different drugs, we list their risk of dependence, we list possible short-term and long-term effects, as well as the effects of overdose. Now, what I see happen a lot of times is that many institutions kind of use a shotgun approach, and they just develop a common list of drugs or a common list of drug categories. And once they've created that list, they really don't alter it, they don't revise it, they don't update it. But one of the things about this document is when you list drugs in this document, what it really implies is that these are the drugs that are being used by your students, staff, or faculty. And one of the things that I like to encourage institutions to think about is, how do you know what drugs are being used on your campus? What data have you collected to determine that these are the drugs of use? So do you have a survey? Are you looking at student conduct records? Are you looking at housing violations? Are you looking at transports? Are you looking at data that's provided through your medical center or your counseling clinic? How are you deciding that list? And I encourage institutions to look at that, every year, if not every other year, to determine if that might be an area where things have changed and new drugs need to be added, or drugs that really aren't being used on your campus can be taken away. There also needs to be a description of drug and alcohol prevention programs available to your students. And again, it's the continuum of care. So I would say, put in a description of everything from prevention to treatment to recovery and the whole entire scope of care that exists on your campus. Disciplinary statement that your institution will impose sanctions on students and employees consistent with local, state, and federal law. And that description of sanctions would include up to expulsion or termination of employment, referral for prosecution. This is where, as a practitioner, I know that we need to include what the worst case scenario is. But as a practitioner going out and educating students, I think it's also important to be realistic about what your institution is doing. There is a lot of power loss when you go out and say to students, if you use drugs, you're going to be prosecuted and you're going to be terminated and expelled. When in the reality of our institution, many of our students may be getting an educational intervention, a fine, community service. So describe what is typically being applied in terms of sanctions to your students when they violate, whether it be on campus, local, state, or federal laws and policies. Moving forward, the BINO review. We're required to review our programs and policies every 2 years. And one of the questions that I often get is, when are we supposed to do this? When is it due? Do we have to do it every even year? Do we do it every odd year? And the reality of it is that there is no specific date in which the report is to be filed. As a matter of practice, the Department of Ed recommends that we do these BINO reviews during even number years and focus our reports on the 2 preceding academic years. If we go to page 13 of that 2006 books, you'll see a page capture in front of you that really kind of highlights the recommendation. Part of the even numbered year practice stems from the fact that that certification that all institutions had to send in occurred during 1990, with the first biennial review really supposedly being due and done during 1992. So again, if you are doing it, good sense suggests that you look at the past 2 academic years, you spend some time after the end of that second academic year up to December 31st to do your review and to create your report. And again, this slide kind of gives some guidance as to timelines. I've been asked, so does it mean that we have September 1st through August 31st as listed on this slide? And my thought is that's probably the academic year for a particular school that was being looked at. Now, one of the interesting things is with Clary, we're so used to knowing exactly what we need to report. We're told what data we need to provide and what we need to look at. And the biennial review, in terms of the Drug-Free School and Campuses Act, really doesn't have that guidance. We don't have that prescription. It really doesn't specify what a review should include or how it should be conducted. And when it was developed and written, it was really written in a way to give us some freeway and some latitude in doing what we felt is best. My recommendation goes back to the section on what is a program. Use some standards, use some guidelines to help guide and direct what a program should be. When we look at the biennial review is not really intended to be a brag document. I've seen some schools that have sat down and said, look at all the great things that we're doing, and they have listed every single little thing from an information table and a presentation to the number of students going to a counseling clinic for basics. But we are really to do this review to determine our program's effectiveness and effectiveness of our comprehensive program, as well as looking at our policies and the sanctions that are being applied when policies are being violated. So we really need to be looking at both areas. I know when I inherited a biennial review 20 years ago and it became my duty to do, it was kind of a survey of all the programs and interventions that we were doing, but very little of that biennial review looked at policies. And that is a mistake that I see happen a lot across a lot of campuses. So again, looking at programs, looking at policies. The other thing that I would say about this review is it's not really intended to be a subjective review. The intention is not to get one person or a group of people to sit around the table and go, oh, look at all the great things that we're doing. We're fine. We're happy. We're happy with the status quo. Let's just continue to move on as we are. In many ways, I liken the biennial review process to a strategic planning model, or being in higher education, an accreditation process. Many of us, for our institutions, when it comes time to become accredited, we pull together a team, we look at various data sources, we look at various programs, we kind of do a SWOT analysis, and we kind of figure out through a self-study what we're doing well, what we need to improve on, and then we make some recommendations before we move forward. And then if it's an accreditation process, we have external folks come in and kind of review all of our work and make similar recommendations and suggestions. And I think that's really kind of the spirit of what a biennial review process really should be. We do have some best practices. When we do a biennial review, the reviews often include materials to complement the report. So one of the things that you will hear more frequently is data, data, data. So what data have you used to determine what drugs are being used on your campus, what the problems may be, what's going well, what are things that you need to work on. So again, some assessment and evaluation of the environment, of student beliefs, attitudes, and behaviors, as well as assessment and evaluation of program effectiveness. What are the goals and the goal achievements? So a good BINO review will sit there and say, 2 years ago, we set these goals for this biennium, and this was the progress on the goals that were set 2 years ago. A good biennial review process looks at the big picture, makes some recommendations for revising programs and policies, kind of sets a direction for the next biennium. And most of the model biennial reviews are not done by one person. There may be a person or a department that has ultimate responsibility for assuring that the notice is distributed and that a biennial review process is completed. But a lot of times it is an interdisciplinary task force or coalition that completes that review. Some other things that are considered best practices is that it's a comprehensive program, so we're just not looking at educational interventions and programs, that those things that we are doing are evidence-based or evidence-informed. Again, there's that data collection, that we are looking across the scope of our institution, so we're just not necessarily focusing on problem drinkers or high-risk drinkers, but we may be looking at non-drinkers, we may be looking at those who are in recovery. And again, the biennial review is really kind of a strategic plan of action that dictates and suggests what we're going to do for the next 2 years. And again, having a group format rather than just a lone ranger doing it. So I often get asked, well, where do we start if we've not been doing it, or if we need to revise and review our process, where do we go? And one of the things that I say is collect as much data as you can. Even if you have not been doing this, there's probably a lot of different data points on your institution that you can be able to acquire to really get a picture of what's going on your campus. Again, if you're doing some kind of national survey, that's a good start. If you have policy violations, that's great. You may also look at medical transports through EMS, counseling, clinic diagnoses, medical clinic diagnoses, just a lot of different data points. Now, when we look at that manual from 2006, there are some data points that they really recommend, and that would include the number of drug and alcohol related disciplinary sanctions, the number of referrals for counseling or treatment, the number of incidents recorded in campus law enforcement logs, the number of drug and alcohol related incidents of vandalism, the number of students and employees that are attending self-help groups or counseling groups or going to counseling for alcohol and other drugs. Connected to that might be the number of referrals to an EAP for alcohol reasons or other drug reasons, as well as looking at attitudes and perceptions about the drug and alcohol issue on your campus. So there is some guidance as to data we should be collecting. When it comes to looking at your comprehensive program and looking at educational interventions and looking at therapeutic interventions, most of us are probably collecting process summary or performance metrics in terms of the number of times a program or a service is offered, the number of students who participate. We probably are doing some kind of satisfaction survey results. That is a great start, especially if you do not have a sophisticated evaluation program. But what we are beginning to see is that the department is leaning more towards outcomes. So they want to see outcomes on learning, attitudinal changes, behavioral changes, and they really want us to firm up our methodology. The University of South Alabama was found in violation. They had not been doing a BINO review, and part of their corrective action plan was that they do a BINO review and they describe the research methods and the data analysis tools that they were using to determine the effectiveness of their program. They were also required to identify a responsible official or office that would conduct the review. And I'm hearing this more and more. A few years ago, I was able to go to the National Association of Clery Compliance Officers and Professionals Conference. Jim Moore, who is the director of the Clery Compliance Division, which is the group within the Department of Ed who now is responsible for overseeing compliance with drug-free schools. One of the strong recommendations he made is, just as you have a Clery compliance officer, you should have a designated drug-free schools and campuses officer. When it comes to policies, I encourage people to basically identify and compile everything, look at how they're enforced. A lot of times we have policies that say we should do this or we shouldn't do this, but we don't have any data that's collected to determine whether the policy is working or if the policy is not working. Sometimes people will say, well, we don't have any data because the policy is working. And I would encourage you in your review process to really challenge that. One of the things that the department seems to be focusing on is measuring enforcement consistency. If you have a group of students who are all found in violation for the same behavior, are they all getting a similar sanction? And what you will see on the screen now is a table that I've made to over illustrate a purpose, but I have a colleague on the East Coast. They were having an audit, sent off information, and then a week before the audit came, the department came back and said, we want to see if there is a difference between student athletes and non-student athletes when they violate alcohol policy and the fines and sanctions that they're getting. So that school had to basically develop an Excel file. Every student that was a policy violation represented a case. They had to be identified whether they were an athlete or a non-athlete, and then they had to identify which of the common sanctions was applied to that particular student. In this slide, again, I made it as a point for over-exaggeration, but what you will see is that the non-student athletes typically all had fines. They all had to go to an education class, whereas the student athletes in this scenario all had to do papers. So again, not very even and consistent application of sanctioning across the board. You might see the similar thing within an athletic program if there is not a uniform or universal consistent policy for all of athletics and policies are left up to the team coach's discretion. You might also see something similar where if you have a conservative residence director in one hall, a very liberal residence director in a second hall, and they both have differing attitudes of alcohol use and policy violations and sanctioning, where the students in the conservative hall get nailed to the wall, but the students in the liberal hall for the same offense really just get a slap on the wrist. So we're seeing more and more of this come up in some of the audits. Once you have collected all your data, once you have collected information on your programs, once you have collected information on your policies, I encourage folks to consider doing a SWOT analysis. What are the strengths, weaknesses, opportunities, and threats of your comprehensive prevention program? And from that, make some conclusions, develop some outcomes, goals, and objectives for the next 2 years, and what are some of the recommendations that are being made for the institution to consider implementing during the next biennium. One of the other documents that I will provide to Cindy is a Word document where one day I got bored and I said, what would be the perfect biennial review report and what would it look like? So we've kind of made an outline that we encourage our schools in Illinois to follow. And again, this is a Word document, so I'll send this to Cindy and you guys can have this and use it as you see fit, and maybe use it as an enhancement for your biennial review. And for those of you who may not be doing a biennial review, you might find it as a good guide as to move along. The last few minutes, what I would like to talk about are some of audits and what's happening. For years, the Drug-Free Schools and Campuses Act was not being monitored. It was not being audited. When it was originally created, the stick was, if you don't do this and we find you in violation, we're going to take away all your financial aid. Well, that really hasn't happened. And over time, schools didn't worry about it. You might find yourself in that company and going, we have never done a biennial review. We've never sent out an annual notice. Are we going to get in trouble? And probably the philosophy 10, 15 years ago was, oh, don't worry about it. They're not monitoring it. They have now begun to monitor it. They have now begun to assess it. In FY26, there were 23 schools that were found to be non-compliant. In FY18, there were 32. People ask me all the time about FY17. I admit they changed the format of how they're reporting, and I would have to go through every single non-compliant school for clarity. For Title IV, and I've just not had the time to do that report. But if you are interested in looking at final program reviews and where schools have gotten in trouble and the things that they have not been doing, you can click on these two links. The top link will take you to clarity reports. The bottom link will take you to violators for Title IV, as well as clarity and drug-free schools, and it will get you to individual school reports. In terms of how they are monitoring and looking at compliance through audits, most audits tend to fall within the full financial aid Title IV program review, recertification audit, or the clarity compliance review. So if you're the person in charge of drug-free schools and you're not in financial aid and you're not the clarity compliance officer, I really encourage you to become friends with these folks, so that way when they are told that they are coming, the department is coming to audit your institution, they can tell you and you can be prepared. Audits can also result from a complaint filed with the Department of Ed, an FBI civil rights audit. It could be a media assessment. There are different audits, but again, the two mainly fall into the Title IV recert and the clarity compliance. Within the last few years, the amount of financial penalty has increased up to 2016, 2017. If you were found in violation and if the department wanted to fine you, they could fine you up to $35,000 per penalty for the Drug-Free Schools and Clarity Act. That has now increased to just shy of $54,000. What I see as an observation is that if there are multiple clarity violations, it's $54,000 per clarity violation. What I'm seeing with drug-free schools is you may have 2 or 3 things that they're digging you for, but they only charge you the one fee. I do imagine that that will change, and I imagine that they will begin to have parity with clarity. So if you have 2 or 3 things that are wrong, you may get up to $54,000 fine per violation, but at this point in time, they seem to be lumping them. Some other things that have happened, definitely corrective actions are required. They may require you to resubmit a BINO review, redo a BINO review, have programming. What I'm hearing from a lot of folks that have been audited is if something goes wrong in one area, it triggers audits in other areas, and it increases the rigor of the audit in other areas. If you end up being found in violation, your institutional name is given to your congressional representatives. There is a possibility that your Title IV could be suspended or limited. And of course, there may be negative media attention. And one of the other things to consider is if you would be found in violation and then something goes awry on your campus, your lack of compliance could be used to demonstrate indifference to campus security and AOD issues in court. So some problematic things if you are not in compliance. Some conversations that I've had with folks. The auditors from the Department of Ed typically tend to be lawyers. They typically are not health promotion, counseling, or student affair folks. So they may not know a lot about best practices, evidence-based practices, the current state of the field, other than anything that they may have picked up from their time doing audits. A lot of times when the auditors come, they're just not looking at drug-free schools. They're looking at a lot of different compliances. They may be looking at clarity. They may be looking at Title IV. They may be looking at other things. So they may have a surface level knowledge of the mandates. And what a lot of people have told me is that it's kind of like a now and later review. They'll do a surface collection. They'll do surface interviews. They'll take things. They'll go and they'll do a deep analysis and they'll say, thank you. We'll let you know how you did later. And then they'll go review materials more intently. I also hear from folks that there's varying notification times. I've got some colleagues who have said, I didn't know that we were being audited until that morning. Others will sit down and say, I had weeks notice. So I think a lot of that depends upon relations and communications with the Clary folks on your campus, the financial aid folks, and how well they're letting other people know that audits are occurring. Data. What I hear from folks that have been audited is, how do you know what substances are an issue on your campus? How do you know what things are working? There is definitely a clear focus on data, evaluation, research, and having evidence. I've got one colleague, they knew a month ahead that the auditors were coming. They sent in all the documents that they needed. About a week before the auditors came, they said, in your biennial review, you listed all these educational interventions. Can you provide us with an outcome-based evaluation report for any of your educational interventions? And luckily they had it and they were able to submit it, but I'm hearing that come up more and more when I talk to folks who have been audited. That consistent sanctioning that we talked about seems to be key and crucial. And in some conversations that I've had with folks on the West Coast, their auditors seem to be asking a lot of questions about the role of faculty in developing the annual prevention notice, the biennial review, even to the point of what is the role of faculty in implementing and delivering prevention programming. So that seems to be coming up more and more. And again, that tends to be from folks that I know on the West Coast. And again, you know, who's involved in the biennial review process? Is it more than just one person? And ultimately, who is responsible for the Drug-Free Schools and Campuses Act compliance on your campus? I'm so sorry. We have covered a lot of ground in a very short time, but we do have some time for questions. So let's hear what we have.
Well, thank you, Eric. We do have some questions coming in, so we'll just go ahead and dive into them. The first question is the notice separate from the code of conduct? So this person indicated that their alcohol and drug policy is within their code of conduct, and they're curious if they need a separate notice annually.
Okay. I would say two things. First of all, within that code of conduct, for the section that relates to the drug and alcohol prevention program notice, you need to make sure that all of those content areas are included. If you don't, for example, have the listing of health risk and that, you're not in compliance, even if it's included in the code of conduct. So make sure that all of those areas are there. The other thing that you would have to say is, if you have a code of conduct, how is that code of conduct being disseminated and distributed to all students every year within a 12-month period? And then how do your new students get it? So, you know, if you distribute that code of conduct in the fall, again, how are your students in summer and spring getting it? The department seems to like it being a separate, distinct notice, separate from other things. So the thing that you've got to really be cautious about is when you are saying to students, this is the notice that we are to give you, and it's found here, that's okay. But if you're saying, here's the student code of conduct, you need to read it, they're probably going to frown upon that.
Okay. We have lots of questions coming in limited time, so we're going to do our best to get them answered. A lot of the questions are around whether or not the presentation will be available to you. We have been recording this presentation. It'll be posted on our website, and we'll also post the supplemental documentation that Eric has indicated he'll share with us as well for your reference. So those of you that are interested in sharing this with others, you can know that. Eric, you talked about using frameworks, and this next question is about that. So when using a framework to inform an institution's biennial review documentation, do you recommend choosing one or using a combination of multiple frameworks?
I like using multiple frameworks. So for me, if I were the person on my campus sitting down writing my biennial review right now, I'm not that person, but I would definitely use the network standards. I really like those standards a lot. I would also be looking at the college aim to determine, our individual and our environmental sanctions and how we can move from less effective to more effective. But I also know that there are some professional preferences. So if you're a student affairs folk, you may be more familiar with the CAS standards than the American College Health standards. So again, there's nothing that says that you have to use one or the other. I think it kind of fits based upon your professional background, your preferences, who's part of your biennial review. But probably, looking and picking from multiple ones may be more eclectic and much better for your campus.
Thank you. Our next question might be something that lots of campuses are starting to struggle with as we see marijuana become legalized across the country for various uses. So this is coming from a contact who's in California and indicates that their student newspaper is advertising marijuana. They're seeing this as a violation and risk of loss of federal funding, but their leadership and even their legal counsel is struggling to see it in that way because Edgar 86 does not explicitly state that an institution cannot advertise federally illegal substances. Do you have any thoughts on this, Eric?
I do. And the first question that I would have is, how would institutional funds be supporting that newspaper? If there are institutional funds supporting that newspaper, when we look at the Drug-Free Schools and Campuses Act, it says that, we will prevent illicit drug use. And right now, federal law supersedes state law, it supersedes local law. So even if you have state medical marijuana laws, if you have legalization, in terms of higher education, what the law say is marijuana is a Schedule I drug. It doesn't matter how it's used, how it's possessed, it's against the law. You probably wouldn't allow your campus paper to go out and put ads for cocaine or other illicit drugs currently. So you probably shouldn't be allowing that for marijuana. And, that's just one great example is with the paper. What about internships, practicums? You probably shouldn't be allowing your students to be doing internships and practicums with marijuana related businesses. The issue that we have is that there's not a lot of case law that really has focused on these issues. So we really don't know how things would turn out if they were to go to court. But really, for all purposes, things have not changed at the federal level. We need to maintain that status quo.
Great. And we do have some more questions. We're running out of time, which is why I put Eric's contact information slide up so that you can reach out to him. I think Rich Lucy from the DEA and campusdrugprevention.gov gave us kind of a nice reminder that I think is great to end with. He said, I think it's important to stress that aside from the biennial review being a requirement, it's simply good prevention practice to periodically assess your prevention efforts, and it aligns quite nicely with the strategic prevention framework. And I don't think we could agree more with that statement. Eric, I just want to thank you so much for being with us and sharing your incredible knowledge and expertise around these guidelines and how we can be in compliance, and what better time than now to make sure that we've brushed up on this information as we work on our biennial reviews on our campuses. I do want to leave you with one reminder. We have our November webinar coming up just around the corner, and in honor of Veterans Day, we are focusing our webinar on veterans. We know that's a special population that has needs related to substance misuse prevention, treatment, and recovery, and we're happy to have Dr. Michael Marks, the Director of Supportive Education for Returning Veterans, who will be with us talking about how we can support wellness in veterans on our campuses. We encourage you to register for that at go.osu.edu/NOV webinar. Eric, one more time, I just want to thank you so much for being with us, and
Thank you,
thank the
Cindy.
rest of you for hanging in there with us as we run a few minutes over. We hope you have a wonderful day.
Thank you. Have a good day, everyone.